So pop quiz, ASIP stands for what?
Advisory Committee on Immunization Practices.
Yes.
Well done.
I was going to say America.
What is the role of ASIP, since you've won the pop quiz? What is the role of ASIP in public health? Let's start there.
They're really the rule-setting committee and or guidance around really what the standard is for our pharmacists to provide immunizations to what specific patients, what age ranges. They're really the standard of our protocols.
Right. So you said they really provide guidance, but you start off with rules. Because there's such the solid guidance producing entity, really becomes the rules. Right?
Yeah.
For coverage, for lots of other circumstances. And then how do those recommendations flow from them to practice and policy?
Well, I mean, really, those are the foundation for practice, and that's how our pharmacists are trained to practice based off of the ASIP guidelines. But that does then influence the payer world as well, as far as what they're willing to reimburse pharmacies for and what they're going to cover, based on plan. And so that kind of feeds both the rules from a pharmacist standpoint, but then also the coverage from a payer standpoint.
So ACIP, they will come out with new recommendations at what frequency, typically?
Well, it depends. In most cases, it's, they meet once a quarter, so they can come out as frequently as once a quarter. And sometimes those are smaller tweaks to existing immunization rules or schedules. But really, I would say probably maybe twice a year we see bigger changes for maybe wholly new vaccines and or just drastic changes for certain age ranges.
So new vaccines, new evidence, new pandemics. That's generally the remit for ACIP. How would they affect you with decision support and data? And because you've now got to download whatever comes down the pike from this guideline producing, becoming the rules group, and how does it influence what you do?
So they represent the standard of best practice for providing immunizations. And if a series recommendation changes, I mean, there's a lot of changes. It's kind of a big deal. But to apply it into practice, you not only have to understand it, and because it's changing all the time, but what public health will do and what we will do is we'll turn those rules into an online decision support system. And so the public health immunization registries, we have to update those every time there's a change, which is, like Dorothy says, is probably twice a year. You're updating the decision support engine so that when in fact a recommendation is being made on what the individual need, it's based upon the latest recommendations from the ASIP schedule. So if you don't keep that current, then you lose that opportunity to provide best practice information back to the practitioner or the pharmacist in this case. So it's kind of a big deal to stay on top of it.
Yeah, so big deal, Dorothy, 9,000 stores.
It's
how in the
complex.
world, every quarter, every so often, how are you pushing that down to 9,000 locations with 5 to 10 FTEs in each one of those locations? Yeah,
I mean, it really does take a lot of work to keep people up to date on all the different guidance that comes out. And typically, we're training our pharmacists always, and so this is a part of that training. But when there's a major change, we really like to have an incentive for our pharmacists to really pay attention. And so many times, we'll make sure that they're taking CE accredited training so that they have that incentive to review the training and understand the actual changes that are happening. And again, I think it goes back to making it relevant to them so they can make it relevant to the patient. So what was the actual change? Is it significant to the patients? And how much do we need to explain to the patient about what changed and maybe why it changed?
And so workflow changes. Are those coming along with the new recommendations? Hey, we have to change some workflow, ask a new question. I mean, is it an entire package that goes every single time there's a change, or?
So yeah, I mean, every year we train all of our staff on workflow and process when it comes to immunizations because we think it's that important. And so we do that at least once a year, and we'll try to wrap up all of the changes in immunization rules through that yearly training. But when there are drastic changes, there are changes to some of the workflow as far as like the questions the pharmacist may be asking or patients. We try to minimize all of that, all of the disruption, to make it simple. So maybe it's as easy as talking points for our technicians on the new standards for meninge vaccine, or making it as simple as offering up that information to the patient through digital tools, so that patient can then consume the information and understand it.
So tell me more about some of these other, again, travel recommendations, comorbidities. How are you starting to niche in your pharmacies You've got decision support maybe that says, oh, I can see that they may have these conditions because of the other medications they're on. I can see their age. How are we going beyond, again, just the generalized ACIP guidelines to specific targeted communications to specific populations? So comorbidities, what does that conversation look like?
I mean, I think it goes back to the broader conversation with that patient around, you know, the medications that they're coming in for, the reasons that they may be at higher risk for some of these vaccine-preventable diseases, and then really getting into, hey, this is what you're going to need to be getting from a vaccine perspective, and this is kind of setting the expectation of this is what the schedule may look like. So back to the point of, hey, maybe at the age of 35, you'll have to come back in for your next pneumonia vaccine. Excuse me, 65 for your next pneumonia vaccine. Something like that, making it very easy for the patient to kind of understand how their health condition fits into their risk for a vaccine-preventable disease.
So moving away from you're just supposed to do it, so do it,
Yeah.
to here's why, here's the importance of it, not only for you, for your family, for your coworkers, and the rationale. And oh, by the way, here's what follow-up looks like as well, essentially. Excellent. What's the single most important workflow you've implemented in your pharmacy to optimize vaccine screening and administration, Tana?
The screening that makes it easier for, like I've mentioned before, our technicians and our pharmacists to feel more
At
confident.
drop-off.
Yes.
So sort of onboarding the patient, they're getting their meds.
Yes.
Here's the fastest, easiest, most efficient way of screening so that you can have really a targeted patient-specific conversation.
Right, beyond flu.
Beyond flu. Excellent. And for you, Dorothy?
And I would say it really goes back to some of the digital tools that we have to let that patient see that information and understand maybe what some of the recommendations are before they even walk into the pharmacy so that they can bring that conversation up, or when the pharmacist does bring it up, they know that it's not the pharmacist just making things up, that it actually is based on some fact. And so I think having some of those tools available for our patients has been instrumental in making sure that some of that knowledge is there beforehand.
We're pretty familiar now with the APHA training program. All of us that have immunized have gone through it, so it's nice to have a universal program. It's pretty well-established training now. If you could add one thing to that training as now experienced immunization specialists, what would you add?
For me personally, I would add how to administer to pediatrics in the thigh. I really would like to have that added because we do that for flu.
Sure. Good point. What else?
I would like to add role-playing, scenario role-playing for our pharmacists to feel comfortable, and now there's actually technicians in certain states that can administer vaccines, so also letting them do that role-play to understand how to approach a patient in the first place. Again, I think the administration, a lot of people are very comfortable with, but how to approach the patient and let them know what is recommended.
Emily, Mike?
Those are good.
I think if
They
it,
said, we'll let you take care of it.
well, if it's, there probably should be a focus on data and analytics and using that to, you know, part of the objective of using data is to really empower the pharmacists so that they have a good conversation to engage the consumer. So
We miss that all the time, though,
think
right? We
that's-
focus on the care, which is great,
Yeah.
that's natural, but it's really care, workflow, and billing. Right? We miss the workflow and the billing part every time we educate on something, and that's what hangs us up from providing the care. So this idea of where do I find information, how do I use decision support, and workflow being a part of those exercises. What else? What other training gaps that are out there?
there's going to be training gaps. All we have to do is ask the patient. You know,
Okay.
when you come in,
So there's an aspect of motivational interviewing or
right, the social engagement kind of aspects.